Hi, my name is Jennifer Luck, a student in CUNY SPH's HPEM program. Today, I would like to present to you a beginner's manual to building public-private partnerships. Public health is chronically underfunded, leading to a decreased surge capacity to manage public health crises. Public-private partnerships could serve as a partial stopgap, but there is a need for more comprehensive beginner's manuals in building cross-sectoral partnerships for beginning nonsupervisory public health personnel, as existing manuals are either too partisan or are incomprehensive. For some background, despite the U.S.'s $3.8 trillion in annual health spending, less than 2.6% is allocated for public health expenditures. Since the fiscal year of 2010, both state and federal budgets have stagnated, and even with the funding increases in 2020, the budgets have only just become equivalent to amounts allocated prior to the Great Recession. The CDC's Emergency Preparedness and Response Fund in particular, the primary source of federal aid to state and local agencies during public health emergencies, has had its funding repeatedly cut and sequestered, leaving less than half available in the annual budget to assist states and local governments, as seen on the chart on the right. These cuts have resulted in over 55,000 full-time positions lost in the public health sector. The consequences of inadequate resources and dated infrastructure on the U.S.'s emergency response capabilities were especially evident at the start of the pandemic, when agencies were scrambling to obtain PPE and forced to contact trace with paper, phone, and fax records. This outdated technology created bottlenecks in the process of reporting, resulting in almost half of the contacts being interviewed after the critical 24-hour window, which led to inadequate reduction of spread. Though the best long-term solution would be to prevent issues from arising in the first place through sustained annual funding increases, some emergency needs have been partially met by leveraging relationships with private partners, such as seen on the large scale between the CDC and pharmaceutical partners to increase COVID-19 vaccination sites, and on the small scale through supermarkets offering special senior hours for elderly members to shop safely. The goals of public-private sector can broadly be divided as profit-driven versus health-driven. In general, because the private sector is profit-driven, activities undertaken by private entities advance their commercial interests, and success is measured in terms of financial gains and losses, which is in contrast to the public sector, wherein activities are public health impact-driven, and success is measured in terms of health outcomes. So why partner if objectives seem so different? Partnerships between the public and private sectors allow shared goals to be accomplished more efficiently by capitalizing on the other's complementary strengths and supplementing their weaknesses. The public sector often offers political credibility and legitimacy and data gathering analysis skills, while the private sector offers monetary assets, specialized expertise, and access to broader and/or specific populations. Common reasons for partnering are listed above. And you can see that in the example with supermarkets offering senior hours, this accomplished both the public sector's goal of decreasing chances of COVID exposure to the elderly population and the private supermarket's goal of keeping customers and increasing its public reputation. There are a couple considerations to keep in mind prior to partnering which can help increase the chances of having a successful partnership. Number one is what you want to accomplish. Understanding the parameters of the project allows you to run a cost-benefit analysis to determine what resources may be necessary for your organization and where external investment may help. If external investment is determined to be helpful, then consider what does your partner hope to accomplish. Organizations need not, and indeed often do not, share the same reasons for partnering. However, having a greater understanding of the other party's reasons for wanting to collaborate enables easier creation of specific measurable goals for the partnership and greater mission alignment. The next question to ask yourself is if the partnership is viable. To be viable, there should be mutual benefits, clear potential for mission alignment, and minimal risks, which can be assessed through the risk-benefit assessment. In general, the partnership must be worth more than the investment of resources necessary. Once you have determined a partnership to be viable, we suggest you look into your agency's legal requirements for partnerships. Most agencies require a Memorandum of Understanding, a legally non-binding document that outlines broadly the mutual understandings, goals, and objectives shared by both parties, of which components typically include partner organization details, goals and objectives, operating principles such as specifics on how decisions will be made and conflicts resolved, what metrics determine if the partnership is meeting its objectives, and how the MOU can be renewed, modified, or terminated. It also includes roles and responsibilities and accountability measures. Since much of the information used in the construction of an MOU is also helpful for establishing the scope of your future partnership, we suggest beginning the negotiation process with your partner early to increase transparent communication, one of the keys to a successful partnership. This process also provides an opportunity for legal counsel of both parties to ensure planned activities are consistent with both agencies and other authorities. When measuring the success of PPPs, it's comparable to measuring the success in most public health programs, wherein the partnership needs to set metrics early and conduct iterative reviews and analysis, both quantitative and qualitative, to understand where the program is doing well, what areas are not working, and test for solutions. When the partnership is found to be no longer useful or necessary, as is typical when we suggest using the following steps to increase chances of amicable dissolution. Step 1. Review your Memorandum of Understanding. See what you agreed to specifically. Step 2. You then need to review the resources. You then need to discuss the decision with your partner and review the resources still invested in the partnership and the plan to address any debts or continuing responsibilities you have. Third, begin official proceedings. The MOU you both drafted likely has a clause regarding dissolution, which may be as simple as one partner giving written notice to the other partner to as complicated as requiring a quorum vote. If needed, consult your agency's legal team. Next, notify others. You need to notify the relevant parties of the planned dissolution. Lastly, settle and return all unused resources that have been invested into the partnership. To sum up the steps from earlier, this chart provides a graphic overview of what can be expected over the course of a partnership. On the left, you see before partnership, in the middle, during partnership, and in the last, dissolution of partnership. Steps are overlapped if they can happen concurrently.